Now, of course, one of the biggest stories at the minute is this allegation that Dominic Cummings, the most senior advisor to the Prime Minister, travelled to Durham while his wife was suffering with COVID-19 to stay with family. Is what Mr Cummings did safe?
Well, clearly not, in that he undermined the core public health messages, which was to stay home, to make sure that children were not left with elderly relatives, and also going from an area which was ahead of the country, London, to an area which was a bit behind, which is northeast England. And northeast England is now one of the hardest hit parts of the country. So the clear thing I would like to see is, yes, he needs to resign, but we need to also move on and refocus on the key issues facing the UK, which is the UK now has close to 60,000 excess deaths, one of the worst death rates per capita in the world. We're in a lockdown. We don't have a good way out of this lockdown because there's no testing and tracing infrastructure to let us safely lift the lockdown. And we have a lot of people suffering because of a lack of clear strategy of how we're going to move forward and get out of the deep hole that we're in.
One of the successes has been getting the public to obey the stay-at-home message. Are you concerned that with the defence of Dominic Cummings, there's almost been a suggestion that the rules of the lockdown are open to interpretation and what the consequences of that could be?
Definitely. I think right now the key message still needs to remain, follow the regulations of the government. You should not let one person detract from the larger message, but also that we really need to be thinking who's taking the sacrifices and bearing the brunt of this lockdown. And it seems unfair that there's one set of rules if you belong to a certain part of society and another set of rules if you don't. And I think possibly the government's misread the public reading on this, because it's not a political issue at all. This is about right and wrong, a public health response, and trying to get through a crisis where every single person in the country is affected.
I mean, do you think that the lockdown is beginning to fray now anyway? Certainly, anecdotally, it feels that there's lots more people meeting up.
Well, it's understandable. We're 8 to 9 weeks into a lockdown, and a lot of people are bearing the price of this. And I think this just points to what has fundamentally changed over the last 8 to 9 weeks during the lockdown. Other countries went into lockdown rapidly. They used the lockdown to drive down the number of cases. I'm thinking of Germany, Denmark, Norway, New Zealand, Australia, Greece. Then once they've driven down the number of cases, they know they can safely lift the lockdown because their testing and tracing systems can take over the hard work of suppressing the virus, and so that society can resume, kids can get back in school. Businesses can reopen, shops can reopen. And I'm looking now, and we're in May, and we've been discussing testing and tracing since February. South Korea's been doing this in January. And I'm just wondering what has fundamentally changed over the lockdown. And I guess that's also leading to fatigue.
One of the big decisions, of course, is when to reopen schools. On June the 1st, it's expected, although not confirmed, that nurseries and some primary age children will go back to school. Do you think it's safe for children to do so, and is it safe for teachers to do so?
Well, I think I have to break down the question to say, is it safe enough? What is the threshold of risk that's acceptable? And I think the 3 principles to follow with schools are, first, to be completely honest and transparent with teachers and parents about the scientific uncertainty. We know children carry the virus. We don't know the degree they transmit it to adults. We also don't yet know how rare it is for children to have this delayed inflammatory multi-syndrome condition, which means that several weeks after exposure to the virus, they have a severe inflammatory reaction. The second thing is we need to have monitoring in place, testing, tracing, and the ability to break chains of transmission and identify quickly clusters in schools. Germany is actually testing kids as they come into school to make sure they catch cases as fast as they emerge. And the third is we need local level decision making and data. In some parts of the country, we look at local authorities, there's thousands of daily cases. Look at the northeast of England. In other parts, there are a few dozen. It obviously makes a difference whether you are going to open a school when there's a lot of community transmission or where there's very little. So we need local level data and decision making, and possibly a system of green, orange, red to let parents and teachers and the community know of what the level of transmission is like in your particular community.
An interesting idea, that one. You were talking there about the need to use data. It does feel as if the R number, or the rate of infection, how many people each infected person passes COVID-19 onto, has really been linked to the easing of the lockdown. Do you think that's the right measure to use?
I think there's been too much emphasis on R as one metric to try to determine how to actually manage the lockdown. The real basic question is, how do you suppress the virus as the lockdown lifts? What is the package of interventions you need to drive the virus down to a safe enough level that people can emerge and circulate and socialize? And there, I think the questions we need to be asking are, how many daily new cases are there in a particular area? also the R number as well, but also what is the testing and tracing capability like? Is it working? Is it up and running? So I think we need to have a package, let's say, of interventions that are monitored across a number of metrics.